We continue to monitor returning travelers that now, what we try to do, probably most importantly, is to give you the right information the management of this pandemic. And that's why we all need to work together so that together we can defeat COVID-19. Following the declaration of a pandemic and increasing spread in countries, we carried out a review of our case definition. We have added 3 new countries to the existing list of 5 high-risk countries with widespread community. Therefore, 8 countries are in our priority list, and these are China, Japan, Iran, Italy, Republic of Korea, France, and Germany. Also advise self-isolate for 14 days on entry. Between the 7th of January and 15th of March, that was yesterday, 2020, a total of 48 people who met our case definition have been screened for COVID-19 in 8 states, namely Edo, Lagos, Ogun, the Federal Capital Territory, Yobe, Rivers, Kano, and Enugu. One was positive, that is the contact of the index case, and one result is pending. There has been no death recorded. The index case is clinically stable and has improved greatly, and we look forward to progressively this week to guide the medical team in discharging him. In Enugu, a woman in her 70s returned from the UK and had symptoms of fever and mild respiratory illness. Her sample was collected for laboratory diagnosis, and happily she tested negative for COVID-19. I'm sure that last 2 days or thereabout, this was viral on the social media. Therefore, as at the 15th March 2020, Nigeria has recorded 2 confirmed cases of COVID-19. 1 case is now negative and has been discharged from the hospital. That's the contact case of the index case. Well, an update on our response activities. The Multi-Sectoral Emergency Operations Center, led by NCDC, continues to coordinate national response activities. NCDC has developed a guidance for mass gatherings. We have not advised against any closures or cancellation of large events. However, organizers must ensure that appropriate measures are in place, such as temperature scanners, hand washing facilities, etc. The DG NCDC will talk more on this later. An interim case management guideline has been developed and disseminated to health workers. We are training health workers from all states in stages. This has been completed in Lagos and Ogun, well, apparently for obvious reasons. Citizens are advised to discourage the spread of misinformation and disinformation that cause fear and panic. We don't need this at this point in time. Let's continue to spread facts and not fears. Please only rely on information shared through the official channels of Federal Ministry of Health, NCDC, or State Ministry of Health. NCDC has launched a new website focused solely on COVID-19. This website is updated daily and has all the information needed, including daily situation reports, guidance for schools, guidelines for health workers, and more. The website remains as announced last week. It is covid19.ncdc.gov.ng. covid19.ncdc.gov.ng. Now, before I yield the floor to the DG NCDC, let me just say a few things. Now, we cannot overemphasize the need for personal hygiene, particularly as it relates to hand washing. It still remains one of the most potent measures for prevention and control. And of course, in addition to use of alcohol-based hand sanitizer, which is usually very, very handy. You carry it in your pocket, in your bag, in your car, everywhere. Now, having said that, there is the phone handset, which I want to refer to as personal essential companion to virtually all of us. It's important for you to wipe the phone as well, because you handle it and you put it in so many places and all that. So part of the hygiene, wipe the phone as much as possible. Secondly, I think more than at any other point in time, this is the time to escalate cashless society. You see some of the bills, you won't even want to handle them. So the less cash you carry this time around, I think the better for all of us. I think we need to take that in. Well, the other thing I want to say has to do with so many things on the social media, but most importantly, we should be conscious of not being complacent. The price to pay for complacency is huge. And what do I mean I've heard even some of my old friends say, oh, the black man's gene is resistant, and so COVID is not for us. Don't forget, some black men, even from Africa, even from Nigeria, they are dead now, unfortunately. We had the story of one doctor in Italy, in Nigeria, a black man. So we shouldn't be taken away by this, or to say that, oh, the tropical setting, the temperature will not allow. There are a lot of things known about COVID-19. There are a lot of things still unknown. And the research continues. And we have to be very careful about taking in claims that are yet to be fully validated. Two things: what is enough for the wise, and secondly, obedience is better than sacrifice. Thank you very much.
Thank you very much, sir. May I please call on the Director General of the Nigerian Center for Disease Control, Dr. Chike Ifiazu, to give us an update for NCDC.
So good morning, ladies and gentlemen of the press, Honorable Minister, my colleagues. The Honorable Minister has really provided an in-depth update, so I'll focus my comments on three simple points. Firstly, to start on where he stopped, on the role of the media in this critical response of national significance. So normally, gentlemen and women of the media are requested to report equally on two sides of the story. So when there's a football match, you report from two perspectives. In politics, you report from two perspectives, or multiple when there's a multiple party democracy. In a situation like this, the responsibility on the media outweighs any of that. And what really distinguishes all of the professionals in the room today from all the others on social media is your responsibility to focus on facts. Now, focusing on facts is not always easy, because sometimes you have to say you don't know. Sometimes you have to do that extra work of going to do a little bit more research, because your responsibility in terms of how the rest of the country reacts and responds is enormous. So I really like to congratulate you on a bit of restraint over this weekend in reporting the case from Enugu, which we were dealing with. Despite it being all over social media, I think most of our conventional media handled it with restraint and respect until the result came out negative, and we shared that to the clinical care providers yesterday. So some of you know I was in isolation because of my trip from China. One of the most important things I learned from China was what they called an all-of-society response. So the entire society was mobilized to move the country out of that outbreak phase. It wasn't left to government or doctors or Port Health Services or China CDC. Every single person in that country was mobilized to move the country forward. So I really appeal to all of you to see this as our collective challenge and our collective responsibility in providing Nigeria the information to move the country forward. Secondly, we are working across board. This is a very complex response, from Port Health Services to getting laboratory testing assured across the country. So what is happening in Abuja is a small part. But remember, when people come back from anywhere in the world, they land in our 4 airports and then they disperse. And anytime within the next 2 weeks, If they have a fever, we have to collect a sample, get it to a lab, test it, and return it to them and inform the response. That means from Zamfara to Akwa Ibom, from Lokoja to Ilorin, we have to assure a certain quality of this service. So it is not easy, and we need your support to enable us to do this. It is not perfect, but we're improving every day, improving sample collection, improving testing, improving turnaround times, and all of that. Reviewing the case definition, you would see the Honorable Minister included 3 more countries. We are aware of other countries where numbers are increasing. Every day we're looking at this, advising government on what to do. The final point I'd like to make is there are new guidelines being developed every day. A lot of the work, we have to assure our schools, doctors, commissioners in the state, everybody wants to know, what do I do? So a lot of the work we do at the moment, apart from the response work, a separate group of people are working every day, developing new guidelines for schools, for mass gatherings. All of these are available on our website. We haven't printed them, not because we can't print, but we know that the information is changing so rapidly. So our advice today might not be the same in 2 weeks' time when the epidemiological situation may change. So please help us disseminate some of the work that we're doing collectively as well, in terms of what is available on the website, how you can get it, how you can assure the schools. We will continue sending it around through our own networks to the commissioners, CMDs of tertiary hospitals, school proprietors across the country, the private sector healthcare providers. We provide care to 60–70% of all Nigerians. So I'll summarize, I'll stop here by saying we need everybody, and most critically, we need you, the media, to be part of the response. And don't see yourself only on the outside reporting on the response. We really like to pull you in as participants. If you can take one of those guidelines, school guidelines, case management guidelines, and do a splash on it tomorrow or next, it will be a great service to the country that belongs to all of us. So thank you, Honorable Minister, for the opportunity.
Thank you very much, sir. With the permission of the Honorable Minister of State, the questions and answer session begins. Please kindly go straight to the point and be brief. Thank you.
Good morning, so my name is Fred Izzy. I work with the Sun newspapers. One very quick one, sir. Some weeks back, we were here, when we were talking about the India's case. I asked the minister then, in 2014 we had Ebola, and then Soya was one that brought it into Nigeria. But now we don't know the identity of this guy. The second contract, we don't know the identity, and the minister told us some days back that he will discharge this week. 2 questions here now. Precisely when I'm looking at to see this guy, and possibly because Nigerians see this as a scam. Yes. In fact, both people at the lower and the tail level, they see this COVID as a scam because they don't see anything, they don't see the person. Is there any way we can convince Nigerians? Maybe we in the media, take us, let's see this guy, maybe when he's discharged. Let's see him, let's speak to him, let's really know him. I think it will give Nigerians more confidence to believe in him because they think this is another way to milk Nigerians. And they remember 71 million naira were given to protest services before the arrival of the king. Shortly after arrival, we had over 300 million naira. And last time we were asked how much has been used, how was it used? Can you give us update on the financial division of these things and what is required for that more, for the other contributing activities? Thank you.
Good morning, sir. My name is Friday. I'm a reporter with Channel TV. 2 questions, sir. The first one has to do with our neighboring countries that are currently recording increasing cases of this disease, precisely Ghana. We have quite a huge number of Nigerians in Ghana. As of yesterday, their cases rose to 6 confirmed cases. Now, I want to know are we going to apply the methods that we use in Ebola? Because at the last briefing, the minister did say that yes, we do not have any confirmed case as we speak, but we are not off the hook because many countries still have it. The method we use in Ebola, where we send some of our medical team to assist our neighboring countries to help them get rid of Ebola. I'm going to adopt that kind of approach so that we'll feel a bit more safer. Because if our neighboring countries are having high cases of this disease, we are really not safe at all. That is one. The second question has to do with the self-isolation method that we are using. Now that the number of risk or high-burden countries that will raise our red flag and has increased to it, are we going to adopt the method of, if we have a traveler from those countries, we move him or her straight to isolation as against the self-isolation method that we are using, or have another way to handle it? Thank you.
Good morning, Honorable Minister, sir. Shuni Basics is my name. I work for the Guardian newspapers. I want to find out what's giving us that confidence to insist on not placing travel restrictions. You know, because I went somewhere and the man from one of the Western countries mentioned that they were surprised that blacks are not really down with this COVID-19. But Honorable Minister, sir, don't you think that even some of these countries that their nationals might, see Africa as a place of rescue, then they might start trooping in with the virus and will be overwhelmed? Can't we take action and err on the side of caution before this thing escalates? Then number two, I went to the toilet there. I found out that there is no for you to wash your hand, let alone a sanitizer or anything. Can't we practice what we preach? Please.
Good morning, all. I think it's been so far so good for us as a country. We have every country to be happy, with our situation at the moment. But like the minister rightly pointed out, there should be no room for complacency. It's on that note that I want to ask, sir. And this question is right to what my colleague from China asked, talking about the self-isolation method. The case in Enugu, fortunately for us, turned out to be negative, but the woman was said to have traveled from the UK to Owerri, then maybe ended up in Enugu, before the execution. I want to ask, if one is in self-isolation, like I've watched in some foreign India, to be specific, the Chinese global TV. So I thought that until she was free. Is it the same thing that obtains here? We have enough personnel to carry all of that out. Then, secondly, I know that travel restriction comes with a whole lot of things. Why do we see us going down that lane in view of the fact that we're even reviewing our case detection strategy by increasing the number of countries that that are affected by our travel advisory at the moment? Thank you.
preparedness or readiness of our isolation centers, because we visited one of the isolation centers that was said to be ready to receive the patient, and we discovered that the place was in a terrible state. One of the isolation centers in Abuja. So, God forbid if we have a case in Abuja, where are we going to keep them?
Good morning, sir. My name is Okon from AIT. Sir, I understand that, although I'm not a doctor, but I understand the workings of when it comes to medicals. If a person tests positive to any illness, I think it takes a while, like a couple of weeks, for you to. But this one we had on Monday last week, we were told that the second illness case was positive, and then the second contact case was positive, and then on Friday we were told he's negative, and then today he's been discharged from the hospital. What is keeping the illness case in the hospital till now? From the very first one, what we hear is clinically stable, clinically stable. It's not time for him to go home. Thank you.
Thank you very much. May we please have the Honorable Minister of State for Health respond to the questions.
Right. Thank you very much. I want to thank all of you that have had the opportunity of intervention. The first question from Fred, son. I think essentially he's worried about the identity of the index case. Well, and of course the contact as well tested positive. I don't even think it's much of the identity, but that you want to see the person physically. Because I'm aware that in the last two briefings by the Honorable Minister here in this same conference room, similar questions were raised. And one thing that the Minister consistently said was that in medical convention, you want to protect, as it were, quote and unquote, the identity of a patient. That's in international convention, except in situation where that patient expressly says, yes, reveal it. I do know that those of you who have monitored what is happening in Lagos, the Commissioner of Health, Lagos State, Professor Bayame, has visited that patient, this is the Italian, several times, with some of your colleagues going with him, and can only speak with him from a distance. So that is the truth. There is no way you will be allowed to go in there. We should not expose ourselves to avoidable dangers. If you recall the case of, I think the Nigerian doctor that died in, I think, well, he lived in Italy, but I think died in Canada or something, if I got it right. Even the daughter, somebody was called to identify from the distance. From the distance. Not even allowed to come there. So, please bear with us. I think we have, it is not in our interest to hoodwink, if I may use that word, anybody. We don't, the entire country loses from that. The entire country. So, the reality of our situation is that there are people, if you tell them that this is daylight, they will tell you no. And unfortunately, there isn't much you can do to change one's desired reality, which will not conform with the true reality. That is the truth. There isn't much you can do. Somebody can say, in spite of the daylight, no, this is midnight. There isn't much you can do about that. So that is my response, and that's my position on that. Friday, coming on the heels of Fred, FF. There are 6 cases already identified and confirmed in Ghana, and essentially that are we sending help to the neighboring countries. Well, in the spirit of ECOWAS, in the spirit of African Union, if the need arises, we will definitely do that. But we must take care of the home front first. When you get into the aircraft and you're about taking off, you are told that in case of any emergency, wear your own mask, oxygen mask first, before attending even to your own son or to your baby or daughter or whatever. So we must take care of ourselves first, and then we will be willing. And don't forget, the DG, NCDC here, we were lucky as a country, and I give kudos to NCDC. Chikwe was one of those that WHO, the expert committee, 10-member committee, sent to China. It's on the basis of the competence and the ability, demonstrated by Nigeria through NCDC. So you recall that I was in Bamako, Mali, to attend the conference, a meeting of health ministers of ECOWAS when this outbreak occurred. And the Honorable Minister was in Addis Ababa to attend the meeting of ministers of health under AU. And one of the things, agreed on at the 2 meetings, both at ECOWAS and AU, is that we must collaborate, and we must, help ourselves. So that is there, and we'll do that when the need arises. Again, you asked the question, are we not adopting isolation for arriving passengers? Well, our position right now is to do more of self-isolation, supervised. I need to repeat and underline that, supervised self-isolation. In which case, we monitor. Don't forget that the passengers that come in, they fill the self-reporting form, which will indicate the status of their health, medications they are on, any symptoms that they have observed, or whatever medications they are on, and of course the travel history and all that. And of course we do our screening, thermal screening at the point of entry, and then visual observation and all that. But then, we don't consider it very necessary at this point in time to now compulsorily isolate people, particularly when they have not shown any clinical features suggestive or suspicious of COVID-19. So we still do more of this supervised self-isolation. Well, the Guardian asked the question, why are we not imposing travel restriction? Again, we have said it here on 1 or 2 occasions that each country will be at liberty to determine what restrictions to put in place based on the experiences of that country as well as the realities on ground. We have just been able to confirm 2 cases, and we cannot say yes, that is not important. It's important, but not as significant enough as to make us, have these travel restrictions. And probably more importantly, you heard the DG NCDC say that the situation is dynamic. The fact that we have not put in place travel restriction today or at this point in time does not mean that if the realities on ground dictate that even before the end of the day, that will be announced. That announcement will be made. And because we are monitoring, we are interacting with various bodies, in the world, and we also have the guidelines from the WHO. Guidelines, of course, they are not necessarily dictation, but guidelines, things to look at, and of course we adapt to what best suits our own situation. Well, Guardian again, we will look into that observation. I want to accept that that is not too good for the ministry. If you didn't get soap to wash your hands, after visiting the, that will be. Thank you for that observation. It's taken in good faith, and we will correct it. Thank you. Yes. NTA, thank you very much. The Enugu case, which you referred to, the issue of supervised self-isolation. The old lady, had been away, I think, for about 5 months or so, and came in, I understand, by BA to the country, arrived in Lagos, and moved to Weri, and I think a day or 2 later developed symptoms, respiratory symptoms, cough, and then of course fever, breathlessness, and all that. And was immediately taken to Enugu for treatment and follow-up. And of course, she apparently looked suspicious based on presentation, and but necessary things were done. Samples were taken and immediately sent to the lab in Abuja, and happily last night the report came negative. This is the kind of information and personal responsibility that people must take directly, or the people around. It's an elderly lady, but the children took the right steps, and necessary things were done, and that's what we expect everyone to do. You need to also self-report, and as soon as the case was identified, we were informed, both on the leadership of the ministry and of course NCDC, and we followed up on it, and that is what we expect. Well, you also mentioned the issue of travel restrictions. I'm sure the DG NCDC will probably talk more about that, but for now, just as I said earlier on, we are monitoring the situation. It's dynamic. We have not said that we won't do it. We will do it if it becomes necessary, if it becomes inevitable. That's the assurance. Business day, readiness of our isolation center. Yeah, I can assure you that the situation has changed. Yes, as at the time, I recall that even the Senate President visited and was not too happy of the status. But then we are doing everything possible to bring everything to what it should be in terms of facilities of the isolation centers. In all the centers, or in all the cities where you have international airports, Lagos, Abuja, Port Harcourt, and Kano. The Enugu one is presently non-functional. But I can assure you that I don't know when last you visited. If you visit this time around, you will see some remarkable improvement and almost fully ready in Abuja. AIT. Well, the index case presented, let's get that clear, presented with symptoms. That's one. Two, he came from high burden country, Italy. You know, the epicenter of COVID-19 has shifted from China to Europe now. And that is why I warned at the beginning the danger of complacency. COVID-19 has shown itself as a non-respecter of anyone. See, health ministers, even vice president, the husband, or the wife to the prime minister, afflicted. In this case, presented with symptoms, but the contact case had no symptom. It was just out of routine testing based on high index of suspicion that gave him away. And that is in line with what we know, that about 80 to 81, 82% of those infected, one may be asymptomatic, they may not even show any symptoms, or where they do, they just present with mild to moderate symptoms, which can even pass for a common cold, until and unless you really test. And in a question of a few days, the immune system of the body will overwhelm it, and then it gets clear, and that's why it tests, that case will test negative thereafter. And that is not strange here. I think the same thing happened with the case in Egypt. After a few days, it was tested and found to be negative. So nothing unusual in this circumstance. But that is not to say we should let down our guard. We should still do the needful and be very proactive. Thank you very much. I don't know whether Chigwe has one or two things to add to what I've said. Thank you very much.
Thank you, Honorable Minister of State for Health, sir.
So basically, you just talked about the index case. I just wanted to know, you said he's well, this child, this week, how well is he? How stable is he? What is his condition? I think NCDC boss should be able to tell us more about, because he maybe practice president. But you said he's well, he's doing well, he's going to discharge.
Okay.
We want to know how well is he?
Okay, you see, when we say a patient is clinically stable, essentially it means that the patient is no longer manifesting the signs and symptoms that that patient was admitted with. If the patient was having fever initially, if the patient was having fever, if the patient was having breathlessness, these are no longer there. But you don't immediately discharge the patient because these things are no longer there. Clinically, that is, through observation examination and all that. Yes, patient may look. You don't even have to be a doctor at times to see, to look at someone and know that, oh, this person is looking, sick. Now, but you have to go beyond that in this instance. Go for laboratory diagnosis or laboratory testing, not diagnosis this time. You already have a diagnosis that you're dealing with. Laboratory testing, which will be essentially to see what the viral load is like. As a point that it's not even detectable. That is when, and it's just not once. You have to do that on 2 occasions with 48-hour difference, minimum. You check that, minimum of 2 times, and it's negative. That is when you can say fit for discharge. So that's the situation. Chicken.
Oh, you're absolutely right.
So,
sorry sir, like just a rider to that. We're talking about the patient's viral load now, and I want to believe that you must have maybe carried out this analysis. Can you just give us an insight into what is viral load? It's like at the moment, talking about the COVID-19. What's the patient's viral load? Like the second case, we were told last week that the viral load had dropped to a very insignificant level at the moment. Could 7% about the time in that case?
Well, it's still the same thing that I said. Viral load, as the word ordinarily means. That is, if you have a certain level at a point in time, and after treatment and management, it drops. That is just, in layman's, in clinical medicine, you don't have absolute figures. So that's why we'll not tell you that your blood pressure should be 90 or should be 80 over 70 or over 60. No, we will tell you a range. You have a range of normal. That's what you have in clinical medicine. So if you are checking your potassium level, if you are checking your cholesterol level, we won't tell you that it should be 50, it should be 500. No, we will tell you the range. So for as long as the thing falls below what you have your clinical diagnosis, you know the condition of the patient as at the time he or she came in, and you know the condition as at now.
So can it be transmitted again?
Yeah, that's what I want to
So can it be transmitted, like, if the thing is dropped according to you, the next person, like, was sitting on my side, not able to contact it, that was the reason?
Well, to the best of my knowledge, it hasn't been established whether a patient cannot have reinfection. That is, because there are some disease states that confers immunity after the patient has recovered. But in case of COVID-19, I'm not too sure that we have established that right now. The last time, is it truly the last?
Yes.
You can hear your voice.
Please, can you explain?
Use the political rostrum voice.
Please, when you say that you have added France, Germany, and then Spain to the high-risk countries, I don't know. Can you explain what you mean by that? And are there measures that you are trying to, introduce in terms of travel or whatever for people in that category, the countries that you have noted down as high-risk countries, the 8 countries? What do you mean by having them as high-risk countries?
Well, it's the number of cases. It's the high number of cases.
Trying to impose
No, I said that we are monitoring the situation, and then we will take decision that is in the best interest of our country. Thank you.
Sir, once again, a committee was set up by the President to look at the impact of coronavirus on the economy. And I believe the Ministry of Health is part of that committee. How far have we gone? What's the impact of this virus on Nigeria's economy? Even if you're not the finance person, but please can give us an overview of it. Thank you.
Well, I think the most obvious thing is that the price of the crude oil. We know the benchmark upon which the budget was based, the 2020 budget. What we know what the price of crude oil is now. The benchmark for the budget was about $57 per barrel. What you do, you know, I think it is hovering about 30 now. So you can see that huge difference. So ordinarily, it's bound to affect the economy. So we need to do it, and that's why Mr. President, in his wisdom, quickly put in place a committee to look at the whole thing, all ramifications, and then advise as appropriate.
Thank you, Honorable Minister of State for Health. We've come to the end of this briefing. Thank you, members of the press.
Now, please, you did mention earlier the 8th conference suspected to have high body rates. Why is the UK not actually part of the 8th conference, knowing fully well that it is actually high body? Please, can you explain this?
UK is just moving into high body. As at the time, you see, that tells you how dynamic these things can be. Well, without mentioning any country, some countries within a day lost over 300, persons. So that's quite significant. And hitherto, that's why I also mentioned that no country should be complacent at all, because before you know it, and the danger is in community transmission. Once that person gets into that community and you are unable to detect and contain immediately, it spreads. And the critical thing in COVID-19 is the ease of spread. The ease of spread. And that's why, again, I said earlier on that we all in it together. We need to work together to defeat COVID-19. Thank you very much.
Thank you.